This meeting is now being recorded.
Okay, Kyle?
Okay. Thank you, Tia. Can you hear me okay?
Yes.
Perfect. So thanks, everyone, for joining us this morning. This is Kyle Fisher with the Pennsylvania Health Law Project. We appreciate PAC and Tia hosting this webinar. The goal with today's webinar, which hopefully will be a little shorter than last week's, the goal with today's webinar is really to focus in on the medical assistance for workers with disabilities category of Medicaid and a couple of other disability-related categories so that all of you have a good understanding of the Medicaid options that exist for your clients. My goal here is to go about an hour, maybe 75 minutes at most, since I know we're now into open enrollment and you guys are much busier than you were last Tuesday when we had our last webinar. So you'll see here the topics I hope to cover. Actually, before we jump into the topics, I still want to say that I think these webinars, obviously, they're harder to do than in-person training, but I think they're going to be most effective the more interactive they are. So if anything is unclear, if you have a comment to make, a question, please do let us know. And you can do that via the question and answer function, the public chat, or for those of you who have called in, just asking your question over phone. And you may need to do *6 to unmute, or you may not. We'll see how that goes. Okay, so the agenda for this morning's webinar here, you'll see three big topics. We're going to cover a couple of disability-related categories before we get to the main attraction, and those are Healthy Horizons and the Breast and Cervical Cancer Prevention and Treatment Program. And then we'll spend most of the training, or at least much of the training, on the MAWD program. We'll talk some about what income, what resources count, and how household is defined for the disability-related categories, since we are going to be out of MAGI world. So the tax-related concepts we talked about last week and the tax-related or tax-based rules that you know from the marketplace side, they don't apply in terms of what we're talking about today. So we'll learn which rules do. And then we'll spend a minute or two talking about the best way to apply for these categories. Okay. So as we talked about last week, there's not a single Medicaid program, right? So there are, when it comes to coverage, everything depends on category. And last week we talked about the MAGI categories, Medicaid expansion, the new adult category, and we talked about the coverage for pregnant women and children. So largely we're looking at the left-hand columns, the three left-hand columns here on this chart. Today we're going to be talking about the MAWD program, which is the disabled workers column here, and then the adults with disabilities, which is Healthy Horizons, as you can see, is tied to 100% of poverty going across. Again, I think this chart is useful in showing, well, it was useful in showing who wasn't covered before Pennsylvania adopted Medicaid expansion, but it's also useful in showing that the expansion does not eclipse the existing Medicaid program. So it makes it in some ways simpler. It makes it easier to determine whether someone qualifies. But the pre-existing categories like MAWD and Healthy Horizons and Healthy Beginnings for Children, they continue to exist, right? And so this is a visual representation of that. So the expansion category is certainly a huge new resource for your clients. We're getting some reverb in the background. If folks could try to mute themselves, it might help, but then just unmute to ask questions.
Kyle, this is Tia. I'm going to mute.
All guests have been muted. You can unmute your line by pressing *6.
All participants will need to press *6 in order to be heard.
Okay. Thank you, Tia. Can you hear me okay?
Yes, I can.
Okay, great. So I do want this to be interactive, so please don't feel like you have to leave yourselves muted. If you have a question or want to make a comment, *6 and if you've dialed in, *6 to do that. Otherwise, we can use the Q&A or the public chat box, and we'll take questions that way. All right. So here we are, right? So with this chart, you can see obviously APTCs go up to 400% of the poverty level, and you see that that's the left-hand axis here. And this is for a household of 2 on the right hand, so showing household income on an annual basis. The point here is we're talking about really the 2 right-hand columns by and large, disability-related categories that continue to exist post-expansion. This is a chart I saw. It came from a Kaiser Foundation report that was released just in the last week, looking at who's still uninsured and what might they qualify for. And the estimates for Pennsylvania, you'll see highlighted there, just under 1 million uninsured adults. And what was interesting, what was actually somewhat striking to me is the Kaiser Foundation estimated that nearly half of them, 48%, are Medicaid eligible, and only 18% are tax credit eligible, which I have to say was surprising to me. And you'll see about a third there are estimated to be ineligible for any financial assistance, be it because of income, citizenship, or offer of affordable coverage through their employer. I suspect, looking at the data they were drawing, it was from spring surveys, so April, March, May. So hopefully now that, as we looked at some charts last week, and Medicaid population in the new eligible or the new expansion population has continued to increase since the spring. So hopefully that 994,000 number is a bit smaller. But still, I think the overall thrust of Medicaid is, again, a big piece of the puzzle here when you're evaluating coverage options for your clients. That's going to continue to be accurate. So to quickly go over the basics, and I know we spent a fair amount of time on this last week, so I don't want to belabor it. We are going to focus in today's training on category and income limits and then the income and household rules associated for these categories. But the overarching criteria remain for these just like they did for the expansion and for children and pregnant women. So applicants still need to be residents of Pennsylvania, and they're still going to need to meet the relevant immigration status requirements. I think our next webinar, actually, in 2 weeks, is going to be solely on the immigration status prong, but we're not going to discuss it anymore today. So just realize when we're going through different hypotheticals and so forth, the assumption is residency and immigration status aren't barriers. And the analysis, so the logic, and you really want to do this for each person in a household because, as we talked about last week, oftentimes coverage options vary, even within a family. You want to go category, household size, and then income limit for that category and household size for each person that you're working with. So last week we focused on the left-hand column here. We looked at what you can broadly think of as the MAWD categories, modified adjusted gross income. And without a doubt, the bulk of your clients who qualify for Medicaid are going to fall on the left-hand side of the ledger here. They're going to either qualify as a child, a pregnant woman in the CHIP program, or under the expansion category, the new adult category. And these are the MAWD categories which have no resource test and which use those tax-based rules for determining income and household size. Today's training, we're talking about the right-hand column. We're talking about what you can broadly think of as the non-MAWD categories or the disability-related categories. And that's, it's a rough rubric. So I say disability-related, we'll see the Healthy Horizons category also covers individuals who are age 65 or older. So you can qualify on the basis of age alone. Important to recognize, it's harder to get Medicaid with these disability-related categories. It's more work for the applicant. So typically there's an extra form or forms to complete, and there's also going to be a lot more questions around assets or resources. So these non-MAWD categories have resource tests, and it varies depending on which category in particular we're looking at, but of course, that's not the case under the expansion category. So the default, and the default should be, certainly for adults, you want to look first at the expansion category. And I think that the easy route would be to say, let's look at that 138% of poverty threshold and say, well, if they're over that, then marketplace, if they're under Medicaid. And in general, that's right. But as we're going to get into a bit later, even though there's more work to get some of these non-MAWD categories in Medicaid, for some of your clients who are over 250%, who are over 138% of poverty, who do have the option of premium tax credits on the marketplace, categories like MAWD, the Workers with Disabilities Program, might be a much better option for them. So I think certainly you want to keep it in mind. It's going to require some extra questions from you to the applicant or to the consumer you're working with, but in terms of presenting them their option, MAWD might be better coverage and more affordable coverage for them, even if it's a bit more work on the front end. All right, before we get into the STAR here, before we talk about the MAWD program, it's important to understand some of the other disability-related categories first, really the context before we talk about MAWD. So the first one I want to talk about is called Healthy Horizons, Medicaid for older adults and adults with disabilities. Two ways to qualify for Healthy Horizons categorically. A person can be age 65 or older, or they can have a disability. And the disability is defined either by virtue of being on Social Security disability or through the employability assessment form. And I know certainly all of you who've been working with health centers for any length of time are very familiar with this PA 1663, the employability assessment form. Healthy Horizons is your first option for seniors or for low-income Medicare beneficiaries. And that's because it's the default. It's the best fit for somebody who is over age 65 and low income, or who's on Social Security disability and is low income. There is another sort of programmatic requirement here. So if your consumer is not over 65 and they're not already on Social Security, so if they are getting into Healthy Horizons through that employability assessment form, they would be required to apply for Social Security, to apply for disability if they haven't already. The financial criteria. Healthy Horizons has a flat 100% of poverty income limit. And you see what those figures are on a monthly and annual basis here. And you can see it also has a resource limit. So 100% of poverty. On the income side, a resource limit of $2,000 for a single applicant, $3,000 for a married couple or an applicant who has a married spouse living with them. If they have children in the household, if the applicant has a minor child in the household, then the resource limit doesn't apply at all. More details for those of you who have questions about Healthy Horizons or you're working with a caseworker and something's not clear, Chapter 319 of the handbook, Medical Eligibility Handbook. Obviously, take note here, 100% of poverty is less than the expansion income limit. So the expansion category, as we talked about last week, is 138%. And again, this is more work to qualify for Healthy Horizons. So for someone who's on Medicare, of course, expansion is not an option. Then you look, and this is the main, again, the first option for somebody on Medicare. But if they're not on Medicare, even if they have some chronic health conditions, and we'll talk a bit more about this as the training goes on, your first look is probably going to be to the expansion category and not Healthy Horizons, just because it's more work to get into. The employability assessment form. So again, hopefully this is not unknown to you. Hopefully this is a form that you recognize. If an applicant is using it, and this is the main section of page 2, that 2-page employability assessment form, if the applicant's using it, they need a clinician to check box 1 or 2. If they have a permanent disability or a disability that lasts 12 months or more, that makes them a good candidate for Social Security disability or SSI. All right. So like we were talking about, the employability assessment form is used for Healthy Horizons. It's also used, or it can be used for MAWD. So MAWD has that disability prong, which we'll talk about a lot more a little later on this morning. The EAF is one way to verify disability as an initial matter, to be an initial proof of disability for MAWD. The EAF is also used for GA-related medical assistance. and that now only exists for certain immigrants. It used to be a much larger program. It's fairly small now, but just know it's still out there, and it's an option you want to keep in mind for immigrants who don't otherwise qualify for Medicaid or who can't get into the expansion category. If you are working with an applicant or a consumer and they're completing the EAF, it's important that the doctor you're working with or the nurse practitioner, they have to include start and end dates, actual dates, and a good faith estimate. A lot of times doctors will balk, going, I don't know when that broken arm is going to be healed. They don't have to get this exact, right? They're not expecting to be clairvoyant. They just need to have some basis for their estimate. Start dates can be in the past, and that's less relevant now that we have expansion. Once upon a time, it was extremely relevant because it was the only way a health center or another medical provider was going to be reimbursed for services they had already provided. And then if someone's using the EAF, typically they're going to have to resubmit that the following year with a 12-month redetermination. Before we get into examples, I want to walk back. Any questions at this stage about the Healthy Horizons program? And I think hopefully some illustrations will make it a little clearer. But again, I think these trainings go best if they're interactive. Any questions? Okay. Seeing and hearing none, we will press on. Recall our American royalty from last week. We have Kanye and Kim, and they now live off Kim's Social Security of $1,300 a month. They have $2,200 in savings. Kim has Medicare, does either qualify for Medicaid. So take a minute to think about this. And again, I think the best way to learn these ideas, to learn this sort of framework, is to go through actual client examples. Any brave soul want to unmute themselves and tell me how they would start to think about this? It's kind of harder to call on volunteers when I can't see any of you, right? Any thoughts? So, again, it's person by person, so we would need to start with either the husband or the wife, and then we'd think which category is the best fit for them. Public chat, anyone?
Kanye.
Kanye, good. Okay, go ahead.
What's the sequel? You said you wanted to know who would be the one that would qualify for Medicaid, right?
Okay. You think Kanye qualifies?
Yes.
Walk me through it.
Walk you through it, because he's living off of Kim's Social Security, so it's $1,300 a month. So
okay.
If they're together, then they're under the guidelines of the family size.
Okay, and which category are you thinking? I think that's exactly right. So Kanye will qualify for Medicaid in which category?
Eesh, you got me there. MA? GA?
All right. So going back to what we talked about last week, the expansion category, right? So that $1,300 per month is under 138% of poverty, right? So I guess I didn't give you everything that you might need here. So household of two?
Time's been late, I'm sorry.
Oh, thanks for giving us some a starting spot here for this. So category of two. Category of two in the expansion category, the income limit is a little over $1,800 a month. So Kanye's income, you would count his wife, it's $1,300 a month. He qualifies under the expansion category, right? No need to look at whether he has any health problems. No need to look at his resources. He is a low-income adult. He's not on Medicare. Medicaid expansion for him. What about, who is this? Kathy?
Yes. Hi.
Hi, good morning, Kathy. What about Kim? Does she qualify for Medicaid?
Actually, she does.
Okay, tell me more.
She would qualify for, I forgot the correct terminology for it, but she would qualify for the, where she would get the access card because she's still within the income guidelines. So that's where they would help out with the remaining 20%.
Oh, so you were, yeah, sure. So she's on Medicare, right? Because she's on Medicare, the expansion or the ad hoc category is not an option for her, right? That's just one of the prongs. And hopefully folks who were on the training last week remember that, right? So under the Affordable Care Act, Medicaid expansion, anyone who's in poverty and near poverty under that 138% of poverty threshold and under age 65 qualify. Kim is under 65 here, but she has Medicare, so she can't get expansion Medicaid. But again, the first option for someone on Medicare when you're looking at Medicaid coverage to help them with their cost sharing, first option is Healthy Horizons, the category we just talked about. Income limit for Healthy Horizons, if we go back a couple slides, household of 2, and it's looked at on a monthly basis, $1,328. Kim's income here is $1,300 a month. It's under that income limit. Right. Categorically, she qualifies because she has a disability. She's on SSD, so that piece is easy. And then she has to look at the resource limit because, again, it's more work to get on under the disability-related categories. They have $2,200 in savings, which is under the $3,000 income limit for a household of 2 or for a couple. So she qualifies for Healthy Horizons. The husband qualifies under the expansion category. They both qualify for Medicaid. Is that unclear to anyone? Does anybody have questions about how we did that analysis? Okay. So a practice tip here. Hopefully those of you who have done some Compass applications recognize this slide. And this was, while there were some changes to Compass earlier this year, after we adopted the Medicaid expansion, we sort of implemented a logic. So not everyone gets questions around savings or resources. Do you have a bank account anymore? So it's only after this household question where you see the top question there, does anyone have a medical condition or a chronic condition, ongoing special health care needs? If your consumer says yes to that, it's going to ask additional questions. It's going to pop up questions related to their resources. And that's because the logic of the program, for somebody who has a medical condition or a chronic condition, they're going to review that person under the Healthy Horizons category we just talked about. And to do that, they have to ask about savings. If you have a client, if you're working with a consumer who is not interested, is not applying for Social Security, but still has chronic conditions, you have a couple of options here, right? So the question is worded very broadly, clearly. Any chronic condition, any ongoing special health care needed. So if I have seasonal allergies, that's a chronic condition. Do I have to say yes to that? I mean, again, it's a broadly worded question. You could certainly interpret it to encompass anything that's chronic, in which case you'd say yes, and then they're going to have additional questions around assets. They're going to be asked to complete that employability assessment form. So if they have more minor health conditions, you could advise them that this is really asking about conditions that might qualify you for Social Security, so they could say no in that respect. Or if there's any discomfort with that and they want to answer it in the way they interpret the question and say yes, and some of you may already be doing this, they can insert later in the Compass application in the comments box the text you see here. So for someone who you know is under 138% of poverty, you know they qualify under the expansion category, like Kanye in our last hypothetical, then you might want to put in the comment box, I'm only applying for Medicaid expansion coverage, not required to submit proof of assets or disability, since we know those things don't apply in the expansion category, and then ask the caseworker to process the application without this thing. Because Compass, the way the logic works, is going to say, it's going to put up a red flag. If Kanye says he has a disability, he clicks yes to that, they're going to ask for that employability assessment form from him. They're going to ask a bunch of questions related to bank accounts, the value of your car, etc. Any questions about this before we go on? Because I think it's worth noting. I think this is an item that, if you know about it, hopefully it's going to save your applicants a bit of time and also some burden. So that hopefully, because they shouldn't be, if they're applying for the expansion category and they're not intending to apply for Social Security, right, there's no need for them to be bugging your clinicians at the health centers about getting an EAF completed. There's no need for them to be pulling past bank statements and the like and having to determine the value of their car. It's just not necessary. But because of the way the system is structured, they're going to get all of those questions unless they know to clarify, I'm only applying for expansion coverage, the new ad hoc group.
I have a question, Kyle.
Yeah, please.
I was aware of the not having to send in the proof of income, but I didn't know about the asset part. But regardless, so if the person did qualify for Medicaid expansion and you went ahead and you send in the asset information as well as the disability, well, the disability wouldn't harm, but as far as the proof of assets, would they hold that against them even though they would qualify for Medicaid expansion?
No, it shouldn't hurt them. So what would happen here, let's say the welfare office looks at them in the Healthy Horizons category first, and even if they play along and they verify disability and box 2 is checked, and then they send in the asset information and they say have $4,000 in savings or retirement accounts. When they do that, the welfare office should then say, well, you don't qualify for Healthy Horizons because you're over the resource limit, but then they should look at the expansion category and put them in it. The difficulty or the downside to that is it drags the process out. It makes it more work for the applicant, and it's more work for the CAO, and it just takes more time before they have their coverage turned on.
Oh.
So if you know that they qualify in the expansion category, better to put in the application that that's what they're applying for, that they're not required to submit proof of assets or disability, and to ask the county to process this without requiring those things.
Okay, I gotcha. I'm going to ask you a crazy one. Last enrollment period, I came across someone who had no income, no job, and he claimed that he had no resources at all. In the middle of the application, he confessed that he had money in the bank. So I said, well, how much? And he said 100. So I said, oh, okay, 100. He goes, no, 100,000.
Let's put that one to the side, Kathy. I think we can get some more complicated questions around interest income. Certainly if someone is hiding assets from the welfare office, that can present a problem. But in terms of verifying the criteria they need to for these categories, just important to know that there's a way to sort of sidestep those questions around assets for the expansion category with a no there, or explicitly asking the CAO to not require proof of assets or disability.
Okay. So if someone were to tell you that, are you required to report it?
Well, they certainly should not perjure themselves, right? So you want them to answer all those questions in the Compass application accurately. If they have substantial savings and they qualify for the expansion category, it's not relevant that they have substantial savings, except insofar as it generates income.
Okay, I gotcha. Thank you.
SSI versus SSDI. So it's important when we're talking about the disability-related categories, it's important to have a sense of the different Social Security benefits out there. And a lot of times our clients don't really know the difference between these two things. Sometimes a client might just say, I'm on Social Security or I'm on disability, and they might not be certain of what they have. Odds are you're not going to see too many consumers who have SSI who need coverage help or need help getting coverage. That's because SSI, and you see the left-hand side of the ledger here, Supplemental Security Income, it gives someone Medicaid automatically, at least in Pennsylvania it does. SSI is a means-tested benefit, and it doesn't require any work history. The benefit is set $755 a month. Someone's getting help from family or so forth, that could be reduced, but SSI is never going to be more than that. SSDI, Social Security Disability Insurance, on the other hand, requires a work history, typically has a substantially higher monthly amount, and the amount of that award is going to be dependent on how much the person or their spouse has paid into the Social Security system, and it does not give someone Medicaid automatically. It gives them Medicare, but only after 2 years. So there's a substantial wait period. So for those clients who have SSDI, if they're not yet in Medicare, or even after they are, again, Healthy Horizons is the first program you're going to look at for them. Oftentimes their income is too much for Healthy Horizons, so then you want to look at the MAWD Medicaid program. All right, one more Medicaid category before we get to MAWD here, BCCPT, Breast and Cervical Cancer Prevention and Treatment Program. What's notable about this program is it has no income or asset guidelines. All right, so it's a Medicaid program where your income and your resources don't matter. The crux here, though, is that you need to verify that two things: that the woman has breast or cervical cancer or a precancerous condition of breast or cervical cancer, and that she's uninsured. All right, so if she has any creditable coverage through a workplace, through Medicare, Part A even, then she's not going to be able to qualify for this program. It has a separate application, 600B, and the state uses a vendor, which I believe is still Adagio Health, that verifies the clinical eligibility is met. So she would need, I think typically it's an oncologist or a radiologist to verify the exact diagnosis, and that paperwork would go on the PA600B to the vendor and then to the CAO. So if you have any clients who you think fall into this, you want to discuss this program anymore, feel free to be in touch with us, be in touch with me here at the Health Law Project. All right, moving into the main attraction, MAWD. The handbook again, Medical Assistance Eligibility Handbook, and hopefully those of you who were on the webinar last week had a chance to bookmark it or to take a look. Again, it's all available on the publicly available on the website. MAWD is Chapter 316, so a lot of the rules we go over in the next half hour or so you can find, if you want to go through them in more detail, you can find them in the same manual that the caseworkers use. Why do we have a webinar session devoted to MAWD entirely? It's because it's a tremendous resource for our clients. High income limits, high resource limits, a minimal work requirement, and the crux there, lots of people who have chronic health conditions may not consider themselves disabled, and they would still meet the MAWD disability standard. So in theory, it's the Social Security disability standard without regard to whether a person's actually working. But in practice, the state's requiring just that somebody have chronic health conditions, right? So on the severity prong, and we'll talk about this a bit more, I would not suggest that you try to predict whether someone's health conditions are significant enough to meet the MAWD standard. It's more a question of whether they have chronic conditions, they have some medical records that can show they've been getting treatment for those chronic conditions, and that's enough to at least start the process. There is an age component requirement, 16 through 64. So anyone who's age 65 or older, just as with the expansion category, they're not going to be able to qualify for MAWD on the basis of their age. Unlike pretty much every other Medicaid category, MAWD does have a premium. It's 5% of the applicant or the recipient's income. And it does not look at a spouse's income, and it's a flat 5%. Now that's after disregards. So when we talk some about the disregards that apply to work income, you'll see that the 5% is essentially cut in half. So it's much less if the person's income is only earned income, but we'll get into that. So the work prong here, before we get into financial eligibility, so the categorical eligibility are the two pieces that you could surmise from the name of the program. Person needs to be working, they need to have disabilities. The work piece here is a very low bar. As little as an hour a month technically is enough. An hour a month of paid employment. I would suggest, and I do suggest to my clients that they do at least an hour a week. It's just not to create any suspicion on the CAO side. An hour a week, and it can be under the table. It can be informal. They can be working for a neighbor, a friend, a family member, as long as that person is actually paying them, right? So that when they say, you know, my mom pays me $5 to mow the lawn each week, the mom actually needs to pay the person $5, right? And then she would verify that, or the aunt who's employing them, or the neighbor who's getting a ride to the grocery store each week. That person could verify that in a basic letter. And we have a work template, just a simple Word document that folks can fill out the blanks on that I think Tia will circulate to you shortly after the meeting, or after this the webinar is done. So that's the work prong. The disability prong is not quite so clear-cut. It's not as black and white. Again, in theory, it's the same standard as the Social Security standard without regard to actual work. But because of that without regard to actual work piece, it doesn't mean that the person who has this disability is unable to work. In fact, the program requires that they be working. It requires that they be working and they have a disability. So in practice, the definition is more closely aligned to a substantial chronic condition. And again, rather than trying to predict whether it's severe enough, if they have a long-term condition, our suggestion is you have the person apply. And there's a couple of different pieces to that. So how do they prove their disability then? They can use the employability assessment form, and if they actually are working or they can work, they could write, and the physician who checks the box 1 or 2 can write, you know, Mr. Fisher is working despite his disability. Or they can just get a basic doctor's letter, and that's really my preference, where the clinician's willing to do it, or where the practice is willing to do it, because oftentimes an office manager or someone else, you know, Kyle Fisher has chronic back pain and anxiety, and he's had it for years, and you know the prognosis is it's going to continue. It's reasonably well managed with medications XYZ, or weekly therapy, or whatever the case is. The basic letter doesn't need much. It needs basically to be on letterhead. It needs to specify the person's diagnosis and its duration, right? That's enough to get what's called presumptive eligibility. That gets your client 3 months of MAWD coverage. During that 3-month time frame, the client will need to produce the more full set of medical records, right? So welfare will have, likely will send out a letter that says we need whatever medical records you have, and then they'll do a more thorough review of all the medical records through what they call their medical review team to see if it meets the MAWD disability standard. In practice, very few clients have been found not to meet the MAWD disability standard. So as long as they cooperate, as long as they produce those medical records. If they don't produce the medical records, they're going to be denied, and so they'll have presumptive eligibility for whatever, a couple of months, 3 months, and then the MAWD's going to be turned off. But if they cooperate and submit the medical records, and in our experience, the vast majority of our clients, as long as they've had some sort of chronic illness, have been found to meet the MAWD disability standard. So this slide outlines there are a couple of different common types of MAWD client. One is the SSDI recipient, and someone who's already on disability, who meets the disability standard by definition, who just needs to do some work. And a lot of times you'll have clients who balk at that because they, well, I just went on disability. And the federal government says, I can't work. I can't do any work. And again, the point to reassure them here is it can be a very minimal amount. And as long as they're under Social Security's trial work threshold amounts, it's not going to jeopardize their SSDI. So any work they do does need to be reported to Social Security. You know, don't get me wrong, and they shouldn't be hiding it, but it's not going to trigger any sort of review of their disability. It's not going to take away their disability as long as it's a minimal amount of work. And again, that's where we'll share a template so you can see how they can go about structure. The second common type of client is someone who's already working, who has a chronic health condition, who may not think of themselves as disabled, who needs to verify the health condition. And for them, we can't guarantee that they'll meet the MAWD disability condition, but if they have chronic health problems, the odds are very good that they do, and they should apply. MAWD income limits and the resource limit. So the resource limit is $10,000. Regardless of household size and retirement, assets do count against that. The value of a house and the value of a car do not. That's the case for Healthy Horizons as well. A car, a house, household effects, those things do not apply. But savings accounts, retirement accounts do. Money in the bank counts. What you see here, MAWD is tied to 250% of the poverty level. It has a maximum household size of 2, the applicant and the applicant plus a spouse. If that's the case, children don't count towards household size for MAWD. And you'll see 250%, and you see what the actual dollar amounts are for that. A little over $2,400 a month for a household of 1, a little over $3,300 a month for a household of 2. Now, these are high numbers in the Medicaid world in general, but where they get really high is when you look at the income disregards. So is that the next slide? No, we have an example. So we have a single mom here who's working and earning $2,000 a month. Her 8-year-old, she and her 8-year-old are both uninsured. The mom here takes some medication for depression, and she has some savings from in retirement. What are the coverage options? We have a question. Here, others, can you hear me okay? We have a Q&A here. Someone lost their audio.
I don't want to be the only one just responding to you, but I'll answer.
Okay, so Kathy, you can hear me all right? Very good.
I hear you just fine.
Yeah.
Great. So somebody lost their audio. Mitzi, you might, if you can, you can't hear me, you might need to call back in. All right. So let's do this one together here. Paula is age 42, $2,000 a month for a household of 2. She's going to be over the expansion limit, right? So, that's not an option for her. Given her income, premium tax credits are one option on the marketplace. But because she has this chronic health problem and she's working, MAWD is another option here, right? So we can't guarantee that she's going to meet the MAWD disability standard, but depression is a chronic ailment. The odds are very, very good. She would need to verify that through that basic doctor's letter or an employability assessment form. And that's going to get her 3 months of MAWD coverage, right? She's under 250% of the poverty level. So she's under the income limit. She's under the resource limit, the $10,000 limit for MAWD. And her premium would be about $50 a month. So even though a person is not supposed to have the option of Medicaid or premium tax credits, the screening function on healthcare.gov is not going to catch MAWD, right? So almost certainly it's not going to say you have to go get Medicaid coverage in the way it will for someone who's under the 138% threshold. And so you need to explain to the client what the options are here, and we'll talk about the relative merits of one versus the other. This is a somewhat unusual scenario where the parent could qualify for Medicaid and the child doesn't. The child, because they're over 138% of poverty, instead qualifies for CHIP. And I think it would be free CHIP here. We'd have to look back to what the exact income limits are for free versus low-cost CHIP. All right, so we have so Mitzi at Sadler is saying she has lost audio. All right. Example 2. Now we have Josie, 52, and has a handful of behavioral health ailments, bipolar, anxiety, and insomnia. SSDI of $1,400 a month. And she's on Medicare, but she can't afford her cost sharing from her Blue Cross Blue Shield supplemental. I've said this to a client of mine a couple of months back, a couple of weeks back, and this is a client who had Medicare, had a supplemental plan, but after she had a mental health crisis, after she was institutionalized, she put it, she was in the psych ward for a couple of weeks. She had tremendous where the supplemental did not cover the full extent of what she needed, and she couldn't afford them. So what are her options here on the Medicaid side? So the first option, the first default for someone on Medicare, as we talked about, you want to look at Healthy Horizons, right? She's over income for Healthy Horizons, so that's not going to work. But MAWD is an option if she does some work, right? So she hasn't been working. She didn't know that she could qualify for Medicaid if she does do some work. But she does. And so she'll be under 250% of poverty easily. She was under the $10,000 resource limit. And she will have a premium, a $70 premium, which is not small potatoes. But in someone like Josie's scenario here, she would no longer need that Blue Cross Blue Shield supplemental, right? Because Medicaid would be the comprehensive secondary coverage that she needed. So she would actually end up saving money because her MAWD would cost less than the Blue Cross Blue Shield. Might be a little bit of work to get her on it, right? She would have to apply. She'd have to document the work she's doing. Excuse me. But that's going to be a great option for her. Questions about either of these hypos before we keep going? Covering a fair amount here. All right. Here shows you again the third example. This time, instead of having Medicare and a supplemental, Josie's in a 2-year waiting period. Does it change her coverage options? It does insofar as she now will qualify for premium tax credits and marketplace coverage as well. Right? So now we're back into a scenario where MAWD is not her only option, but it's one of a couple that she might consider. And of course, when she then gets her Medicare, right, the premium tax credit option is going to go away, and she'll be left with a need for a supplemental. But until then, at least she is over the 138% threshold. So tax credits in the marketplace are one option, MAWD is another, right? Let's talk a bit about the relative merits between those two things. Right? So the MAWD premium is set, 5%. 5% of the person's income. Looking at Josie here, $1,400 a month is her SSDI. Means her MAWD premium, 5% of that is $70. If she has earned income, and we'll talk about the earned income disregards, it changes the math substantially. On the marketplace side, premiums, we're looking at roughly 3% to 9.5%. It's a sliding scale basis. You guys probably know this much better than I do, actually. So typically the premiums can be comparable. Now that's based on household income. MAWD premiums are based just on the applicant. So if you have a situation where the spouse has income, MAWD can certainly end up being much cheaper premium-wise. Where the real savings come in on the Medicaid side is cost sharing. There's no deductible and very small copays, $1 and $3 prescriptions, for instance. So for all of the managed care plans, there's no PCP copays. If there might be a specialist copay, I think it goes up to $3.80, right? So they're, by statute, by law, they're restricted to being nominal, right? Again, very small copays. So certainly for those consumers of yours, those clients of yours who have health problems, who are actually going to be using their health insurance, you want to give them the option of MAWD. Let them think through whether it's worth the hassle of applying and verifying whatever information they need to get really comprehensive insurance that they can afford to use. The other couple of other relevant considerations here. MAWD offers, like, it's full Medicaid, so there is a dental benefit. There's the ones that have dentures per lifetime. There are, I think, twice-a-year cleanings. It's not an unlimited dental benefit. There's no root canals. There's no periodontal without a higher standard being met. It's got a limit exception. But there's a dental benefit there, and there's also transportation. So if you have clients who have problems getting transportation, getting to their doctors, if they go on MAWD or any other Medicaid benefit, there's the Medical Assistance Transportation Program that helps with that. As long as Medicaid's paying for that service, they can get transportation to it. The downside, I think the probably the main downside is fewer doctors in general accept Medicaid. So that's not particular to MAWD, it's a Medicaid in general concept of that you're going to have more, in general, you're going to have more doctors who take a commercial plan, and I think that extends probably to most marketplace plans as well. But that's often going to be a doctor-by-doctor inquiry, and I know those of you who've encountered some of the narrow network or the proactive plans know that there can be tiered networks where even though lots of the prestigious medical institutions are technically a network, it might cost the consumer an awful lot more to go to the Thomas Jefferson or the Penn and some of the other hospitals and providers available to them. Any questions on this before we keep going? All right. So we have a question about MAWD's premium, total household income determined when determining eligibility. Yes, right. So premiums are based on the applicant's income only, but husband and a wife's income both count when determining eligibility. That's a question from Shannon. That is correct. That's right. All right, one more sort of MAWD versus the marketplace scenario here, because this I think is important. Getting folks coverage is sort of half the battle, I guess probably more than half the battle from your perspective, but of course we want them to have coverage they can actually use, they can afford to use as well. We talked some about cost sharing reductions at the PAC annual conference and how important they are in making sure coverage is affordable. For those clients or those consumers of yours, again, who have severe health issues or chronic health issues and actually go to doctors and go to specialists and have monthly or a number of monthly scripts to fill, Medicaid is much more affordable coverage in general than marketplace. So this is a hypo using a 45-year-old whose income is about 230% of poverty, and you can see the differences in premium, co-pays, and benefits there. So not all hypotheticals are going to be the start. Someone who is at 150% of poverty, once you apply it, assuming they're in a silver plan, they're getting those cost-sharing reductions. Their cost-sharing is going to be a lot less than what you see here, but it's still going to be more than what someone on Medicaid would pay. Spend a few minutes to talk about, I see some Q&A questions here. Let's pause. All right, so a question from Hannah Sindolo. What's the best way to apply for MAWD? Should it be through Compass or a paper application? Both are possibilities. You can do either. I think if you do use Compass, you might specify please review for MAWD. Since it is a somewhat smaller Medicaid category, not all caseworkers are familiar with it or as familiar as they should be, so you want to point their attention to it. If you're using a paper application, there's a MAWD-specific application that we'll share. It's the PA600WD. And then the only downside to that is you're limited to the limitations of snail mail. You're putting it in the mail, you're attaching hard copies, you're hoping they get open, you're hoping they get processed correctly, so it's a little slower. You don't get sort of the instant application verification or the timestamp that you do with electronic submission. Income and household size rules, and I'll pause here to say, don't worry, this is not going to be nearly as complicated as it was with the MAGI categories. So the income and household rules that we went over last week are far more complex than these. What income counts? So the short answer to that is it all counts pretty much. So unlike in the MAGI world where there's some key types of income that don't, for Healthy Horizons and MAWD and the disability-related categories in general, all the income counts. The real question is whether it's earned income or unearned. And for earned income, there are huge disregards, right? So for work income, and these rules map onto SSI rules. So for the disability-related categories, instead of looking to tax world, we look to Social Security rules. We look to what would happen on the SSI side. And in the Social Security arena, there's incentives for individuals to return to work or to work in general. And you see those incentives right here. So earned income disregard is the first the first $65 are disregarded, so they don't count. And then half of any remaining income is not counted towards the eligibility, towards the income limit. And so you can compare, half of all earned income versus the 5% MAWD disregard. There's a huge difference there. For someone who has unearned income, like Josie in our two hypotheticals a few slides back, right? That Social Security disability is unearned income. By the way, earned income here is essentially just work income. Somebody has tips, wages, salaries. If they are renting out a property and they declare it on their taxes, all qualify as earned income. For unearned income is essentially everything else, right? So Social Security disability, workers' comp, unemployment compensation, pensions, that sort of thing. The disregard for that is a flat $20, and these are both looked at on a monthly basis. An example hopefully will make this a little more clear. We have a couple. Frank receives disability in the amount of $1,220 a month, works an hour a week for his cousin. Claire works and earns a little over $4,000 a month. So you'll see their annual total income. The household income there is $63,000, right? We're not really talking about low-income individuals here. It's either eligible for Medicaid. So what this does require is that you do some math, right? So when you're looking at income eligibility for MAWD and somebody has work income, you do have to do a bit of math. Take note, the work disregards, the income disregards we just talked about, apply to an applicant's spouse as well as the applicant. So for Frank here, we know he's on disability, and so then the question is, and he's working, right, and that's likely because you've advised him to work for purposes of becoming eligible under the MAWD program. And then the question is, would they be income eligible? So for his income, it's unearned, right, $1,220. You take away the $20 disregard, and he's left with $1,200 is countable. And then you look at Claire's income. You take away the $65 off the top and divide it in half, and that $4,065 figure becomes a flat $2,000. Their countable income for purposes of MAWD eligibility is $3,200. Right? That's under the $3,319 income limit. Now, for purposes of simplicity, I left out Frank's 1 hour a week earnings, so those would go in, but they're not going to be over the $119 they have to spare. Right? So here you have a couple earning together a little over $63,000 a year who are income eligible for MAWD. They would still need to meet the $10,000 resource limit, and then Frank would have a premium. And going back to Jan Ann's question, the premium is based not on the total household income. Eligibility is based on total household income, but the premium is based just on Frank's. So it would be 5% of that $1,200 figure, so his premium will be $60 a month. I'm going to pause. Any questions on this before we keep going? No? No, we do. Sorry. Q&A here. So the question is, are there multiple allowable deductions or only those I mentioned? So in the Social Security world, there are some other deductions, but I don't know that I want to go through them all for purposes of this training. So if you look to the SSI-related income deductions in the handbook, you can go through. There are some more esoteric ones and that you're less likely to encounter, like work-related expenses or disability-related work expenses. Really, deductions that you see very infrequently, which is why I haven't put those in. But yeah, that is a good question. There are some other deductions out there. The ones that you're going to use routinely are those that we just went over, really the earned income, the unearned income deduction. Whose income counts? Okay, so and this goes back to how is household defined. For MAWD, it's only ever applicant and applicant plus a spouse. You get a maximum household size of 2. So even if there are kids in the household, you're still looking at either a household of 1 or a household of 2. If there are kids in the household, MAWD still has a $10,000 resource limit, regardless of how big it is. For Healthy Horizons, the household size is based on how many people are actually in the family and living together. So you can count the spouse and the children, any children under the age of 21. If you do include the kids, and this is somewhat interesting, it goes back to, I think this is Social Security rules, the children under 21 are optional. And you want to include them typically because it increases household size, which increases the income limit. But if you do include kids in the household, you have to include their income as well. Again, we're away from tax filing rules and tax-based rules on what counts. We're looking at Social Security-related rules. So for kids in Healthy Horizons, you can include them, but they're not mandatory. And if you do include them, you have to include their income. Moving from what income counts to what resources count. In general, it all counts. There are some exceptions. So the main exceptions are primary residence, 1 vehicle, and then household goods, clothing, household effects, etc. Televisions, jewelry. You guys get the picture there. So there is a section on this. There are some other exceptions, something like burial plots. I mean, if you have questions where it matters, take a look at the handbook there, section 340.8. For Healthy Horizons, there's an exception to the resource test altogether. If there are any minor children in the household, that $2,000 or that $3,000 limit doesn't apply at all to the parent. That doesn't hold true in the MAWD context. So even if your MAWD applicant has minor kids, he or she is still going to need to meet the $10,000 resource limit. We're wrapping up here. Any questions on the income or the resource rules or the household rules? A question from Hazelbeth Vaughn. Can we have a copy of the slides? Yes. I think Tia is going to circulate a PDF version of the slide deck after the training. 1 car per couple. Yeah, question on the resource rules. Yeah, so the value of 1 motor vehicle per household is excluded. They can have multiple vehicles, but the equity value of the second and the third vehicle counts against that $10,000 resource limit. So what they will do is exclude the most valuable vehicle, but the value of any vehicles after that does count against the $10,000 limit. Good question. Any others? Okay. How to apply, this goes back to Hannah's question. There are multiple ways. A person can apply all the usual avenues for applying through state portals. So Compass, by phone, by mail, in person. In theory, you can apply for disability-related categories through healthcare.gov, but I would not do it. I don't think it's safe, to be honest. I'm not certain that they're going to be able to catch it. That they'd be asking necessarily the right questions on healthcare.gov. If you've screened your consumer as Medicaid eligible and they want to apply for MAWD or Healthy Horizons, go through Compass or use the state application or the phone. If you do Compass generally, again, specify please review for MAWD if that's what you're applying for, because not all caseworkers are as familiar with the MAWD rules as they should be. And in some counties, I think Allegheny, certainly in Philadelphia, they have centralized units that do MAWD applications. So if someone's applying through one of the district offices, again, and you haven't marked MAWD, there's a chance that the application is going to be improperly denied. So specify, please review for MAWD. If you want to take away any ambiguity, use the MAWD-specific application, the PA600WD, which we will share as well, along with the slide deck and template, the Word document that folks can use to verify informal. As in the MAGI categories, Same time frames apply. Certainly if you have somebody who has a medical emergency, they should get that letter from their doc that specifies, I have a medical problem, please speed up the application to make it go faster, and it can be, you can get retroactive coverage going back 90 days. If you do that in the MAWD context, you need to show that the person was both disabled and working going back 90 days, so it's a little harder to get retro coverage in MAWD. And if you do it, the person would also have to pay the premium for those months going backwards as well. So it's more rare that we see retroactive coverage for MAWD because typically it doesn't make sense, but it is an option. And that's it. We're coming in at about 70 minutes here. I hope this is useful to folks. I will pause definitely now for questions. Like I said, Tia is going to circulate materials afterwards. Any questions? Use the Q&A, the chat box, or you can unmute yourselves, *6. Okay. Hearing none, I will close. Thanks to everyone for joining us this morning. Again, if you have questions on any of this after you look at the materials, certainly feel free to be in touch with me. My email is right there, kfisher@phlp.org. All right. Thank you, Tia. Thanks, everyone.
Thanks, Kyle. Have a good afternoon.
You too. Bye-bye.